Hi, my name is Madeline Wallace, and today I'm going to be proposing a prevention to sonography injury plan. Sonographers are types of ultrasound technologists, and they perform ultrasound exams as part of their daily jobs. If you're not directly involved in the sonography community, you may not be aware that sonographers experience all types of injuries due to their jobs. Common types include bursitis, which is an inflammation of the bursa around the joints, tendinitis, which is inflammation and micro tears in the tendons. The picture on the right is an example of tendinitis in the elbow, and you can see where the micro tears are and how the tendon is red and inflamed around it. Another type of injury is carpal tunnel syndrome, which is experienced in the wrist, and cubital syndrome, which is the elbow. The main areas of injuries in sonographers are the shoulder, elbows, wrist, and fingers. There are many different causes of musculoskeletal injuries. One of the biggest ones is poor posture. As you can see in the sonographer on the right, she's leaned over in an awkward angle and isn't standing up straight. This leads to all sorts of injuries. Additionally, when the arms are at awkward angles, like the picture on the right, the sonographer can be prone to all sorts of shoulder and wrist injuries. When they use excessive force to push on the patient to try to get the best picture possible, they can get injuries in their wrist and their fingers. And the longer the exam, the more prone to injury they're going to be. And that's an issue because many sonography exams take 30 to 40 minutes. When the sonographer is at these positions, they aren't able to get as much blood flow to the joints and tendons and muscles. And this is an issue because the waste products in those organs aren't able to be taken away and nutrients aren't being delivered. So that's the physiologic reason for these injuries. And anytime that you overuse these different types of postures, you're going to be more prone to injury than if you use them and take breaks between your exams. When sonographers are injured, there are many types of consequences. The sonographer is going to have to miss work days because they are in pain or they have therapy or an appointment of some sort. When they do need medical intervention, the employer is going to have to pay for those medical bills. If they need workers' compensation because they are out of work due to a surgery or something, the employer is also going to have to pay for that. And if the sonographer has to leave the department for a month, they can't go understaffed for that amount of time. So the employer is going to have to find a travel sonographer or someone who can come in for a short amount of time to replace the staff. All of this costs a ton of money, and in all, it's costing employers $15 to $20 billion a year, which is unacceptable and also completely preventable. There are many ways to reduce risk of injury. A common type is taking breaks between exams. When this happens, the sonographer can make sure that blood flow is getting to all of those joints and that they're able to recover. This can also be done by switching between study types. For example, if you do a cardiac exam versus a vascular exam, you're using two different arms and you're using different muscles, so the ones from the previous exam are able to get a break. As you can see, this sonographer on the right, she's using proper posture, which prevents injury. Her arms are at an angle of less than 30 degrees so that she's not holding those limbs at an awkward angle. She has a relaxed grip on the probe and she isn't pressing very hard so that she's not causing any injuries in the wrist or fingers. And finally, she's using good equipment. For example, you see that there's a cable brace on her arm. This makes sure that the weight of the cord isn't pulling on her wrist or her fingers, and she's using a sonographer chair that helps her have proper posture throughout the exam. Originally, it was discovered that 84% of sonographers were affected by injury in 1997, and then in 2009, they did another study and found that 90% of sonographers were affected. So the rates have risen over the years drastically, and many of these sonographers aren't just experiencing a one-time problem. It's a problem that they experience throughout the day, so it's something that definitely needs attention. In the past, an alliance was created by the Society of Diagnostic Medical Sonography and the Occupational Safety and Health Administration. They created ergonomic guidelines, which are guidelines that help use proper positioning and posture, and They helped implement these standards among departments. Originally, it was recommended that the Joint Commission of Administration of Hospital Organizations would help enforce these standards, and JCAHO is the administration that accredits different hospitals. So they were supposed to include these in their exams, but it's unclear if they ever actually did. Additionally, around 2003, in the time that this alliance was created, a company called Sound Ergonomics was formed. It was founded by two of the leading ergonomic researchers in the field of sonography ergonomics. And the company sells safety equipment, such as this chair that's pictured on the right, that can help reduce injury among sonographers. Additionally, if a department is struggling to implement standards, they will come in and train the departments on what to do and how to prevent injury. However, if you remember from the previous slide, the injury rates have risen since 2003, so you would expect them to decline, but they haven't. So that means that we need to do something else. So this is where the proposition comes in. I think that the alliance between the Society of Diagnostic Medical Sonography and the Occupational Safety Health Administration should be revisited. They need to create and enforce standards that will actually keep sonographers safe and management accountable. The goal of this will be to reduce the prevalence of injury among the sonography community. This is kind of a long plan to implement, but in the end, it will be worth it. The SDMS and OSHA need to agree to revisit their alliance and improve it. Once they agree on this, they can create an ergonomics checkoff list that has different standards that departments would have to meet. Each standard would have a numerical value assigned to it, and then all of those numerical values would be added up, and a minimum score would need to be determined to make sure that the sonography department is doing what they can to pass their inspection. Some departments are going to go above and beyond and try to exceed the expectations, and those departments should be recognized for that. So the administration should figure out what that score would be, and then on the SDMS website, which already exists, they can create a page for those departments to be listed. This would be helpful to any prospective employees that want to make sure that their future employers are committed to their safety. Additionally, some departments are not going to want to do this at all, and they are going to fail their inspections. When this happens, they will be fined a little bit of money for not paying attention to employee safety. So this score for failing, as well as the money that would be fined, also needs to be determined. Finally, JCAHO would be the organization that enforces this checkoff when they do their annual hospital inspections. So the SDMS and OSHA need to negotiate the use of the checkoff with JCAHO. And finally, before any of this is implemented, they need to train departments on how to meet these standards and what exactly the expectations are. That way, the departments can prepare for it. So you may be wondering, if I'm going to support this plan, how feasible is it? What am I going to have to do? This may create extra work for SDMS, OSHA, and JCAHO employees, but it's something that if we want to move forward, it needs attention, and it might require a little bit extra work. Additionally, there's going to be a little bit of money needed to compensate for JCAHO's time spent in the sonography departments doing these inspections. However, the hospitals that are being inspected are already paying for the inspection, so that will be a little bit of money. And additionally, any money paid in fines will help cover the cost of the extra JCAHO time. So what can you do? You can put sonography safety first. Decide that this is important and it needs attention. Then approach other organizations about creating an alliance and making sure that you can create a checkoff that can help hold management and sonographers accountable for safety. Make sure that you are doing what is right. Thank you so much for your time today, and I hope that you will consider this proposition and what can be done for sonographers. Thank you.